undercover.
It's Wellness Wednesday. Great to have you back here.
Thank you.
All right, it seems like everybody around is sick. You know what it's like. Is it too early to get a flu shot? And also, what is too young to get a flu shot? What is that?
So it's not too early. Our recommendation is that you get the flu shot as soon as it is available. You have to be at least 6 months old to get the flu shot.
That's young. Yeah.
Yes, that's young. But the idea is before 6 months, you can't give the flu shot. So if you have kids who are younger than 6 months, all the people around should get flu shots because the child doesn't have the immunity to resist the flu vaccine.
Almost like the whooping cough.
Yes.
Yes.
So you have to be really cognizant that you get the pertussis and the tetanus and all that stuff. So please get a flu shot if you have an infant at home. If your baby is 6 months old, they should get the flu shot. If they've never had a flu shot, they will most likely need a booster. If they've had 2 flu shots before, then they only need 1 like an adult. But it's imperative because children suffer more with flu. Last year, there were 100 deaths from flu, from influenza. That should not be the case. We should be able to prevent these kind of things. And what they found was that 80% of those 100 kids that died were not vaccinated. So please go out, get the vaccine. It is a safe vaccine to have, and even if you have egg allergies, they changed the recommendations this year, you can still get the regular vaccine. You don't have to go elsewhere.
So as early as 6 months. Hey, I don't know a woman who hasn't had a urinary tract infection, and some of them recurring urinary tract infections, so there's some news here that there's new medication for it.
So there's a huge burden from UTIs, urinary tract infections. The number of ER visits, the number of hospitalizations, it's estimated it's about $1.6 billion in our healthcare industry with the UTIs. As we'll talk in the next thing, as we are giving more antibiotics to people, these bugs are getting more and more resistant. So there is now a resistant bacteria, an Enterobacter, that is resistant to all the antibiotics that we have. So the FDA fast-tracked an antibiotic for a resistant UTI. 50% of people in the hospital who get this UTI that goes into the blood die. So it's a really potent, really bad bacteria. But it looks like we may have something coming down the pipeline, which is this new medication that may help target this bacteria.
All right, here's a new study out. This is really interesting because it really is a mixed bag. It is more evidence of racial disparities in emergency rooms. That's bad, but specifically white children being overprescribed unneeded antibiotics over minority kids.
Crazy.
Where do we go with this?
So I mean, this is not a small study. They looked at 40,000 kids who came into the ER with viral upper respiratory infections. You do not need antibiotics for these. The good news is, on average in our country, 2.6% of these kids are treated with antibiotics, which is not bad. It should be 0, but 2.6 is not bad. But what we found is that the white kids are being treated at 4%, black kids at 2%, and the Hispanic kids at 3%. So we're not sure where this is all falling out, but ironically, the black and Hispanic kids get the right treatment.
Because of perhaps some degree of racism, they may be doing a healthier thing.
We don't know, but it's a little bothersome.
Yeah.
That that's the case. But if you have a child with a viral upper respiratory tract infection, you don't need to give them antibiotics. As we just spoke in the last topic, there are like 2 million people who suffer.
Parents ask for antibiotics.
I know.
Dr. Ahluwalia, thank you very much. Coming up in our next hour.
My doctor never gives them to me.
Good.
They just, they're like, nope, you don't need any.
That's the right thing to do.